This podcast contains our own personal views, not associated with any organisation. Coronial contains descriptions of death inquests that may be graphic and disturbing to some listeners. Discretion is advised. Hello everybody, I'm Alice.
I'm Georgie. Sorry, got me mid-Kit Kat there. I'm Emma.
And this is Coronial.
Okay, today I'll be telling you about the inquest into the death of Corinna Ann Medway, who died on the 22nd of May 2011 from a brain hemorrhage shortly after giving birth to twins. This inquest was held because Corinna died within 72 hours after an operation of a medical or surgical nature. This inquest doesn't include much information about Corinna's background, apart from her relevant medical history. She had one previous pregnancy, giving birth to a son in January 2010, after going into labour at 32 weeks. She was 32 years old when she became pregnant again with twins, and her due date was the 26th of June 2011. She had a condition called Factor V Leiden mutation, and had a prothrombin gene mutation, which meant that her blood had a higher tendency to clot. Because of this, she was on low-dose aspirin during her first pregnancy to prevent excessive clotting. During the first 2 trimesters of her second pregnancy, her blood pressure was normal, but she had a family history of hypertension, which is high blood pressure. Corinna had the same obstetrician for both pregnancies, and he accepted her as a patient for her second pregnancy on the 29th of October 2010.
And when was her due date again, sorry?
The 26th of June 2011.
Oh, okay, so fairly early.
Yeah.
Okay. Yep.
So on the 13th of May 2011, at 33 weeks gestation, Corinna went to the YAS emergency department because she had swelling in her feet and hands and pins and needles in her arms.
I'm sorry, can you tell me where YAS is?
Sorry,
Yes.
we're in...
Yes!
in New South Wales, about an hour north of Canberra.
Okay, thank you.
She told staff that she had a slightly elevated protein reading, and her obstetrician had told her she had an abnormal kidney reading. Her blood pressure was 148/90, which was higher than a week and a half before when it was 140/76. So for reference, normal blood pressure is less than 120/80, and the Society of Obstetric Medicine of Australia and New Zealand guidelines states that hypertension in pregnancy is defined as a systolic pressure of greater than 140 milligrams of mercury, so that's the first number, and or a diastolic pressure of or greater than 90 milligrams of mercury. She had not been prescribed any blood pressure medication for this elevated blood pressure. The staff at the hospital contacted her obstetrician, who advised them to start Corinna on labetalol 3 times a day, which is a medication used to treat high blood pressure. The next day, her blood pressure was 130/80, but she still had swollen feet and a tingling sensation in her hands. On the 16th of May at 5 a.m, so that's 3 days after she initially went into the emergency department.
And she's still admitted at this point, though? Or
I don't believe so. No.
Okay, she left. Okay.
She'd left, yeah. So 16th of May at 5 a.m, Corinna had preterm rupture of membranes, which means that her waters broke before she was in labour. She was admitted to a private hospital under the care of her obstetrician. At 2:20 p.m. that day, he made a note that if her blood pressure reduced to a diastolic, so the second number, of below 70, he was to be contacted to give further instructions. At 2 p.m, her blood pressure was 140/60, so staff rang the obstetrician and he told them to not give the labetalol.
Okay.
So now I'll quickly run through the next few blood pressure readings that she had while she was in hospital. So 5:23 p.m. on the 16th of May, 141/84. 12:30 a.m. on the 17th of May, 132/58 and 135/60. And 5:55 a.m. on the 17th of May, 134/66. So the obstetrician examined Corinna at 2 p.m. on the 17th of May and told nursing staff to completely stop the labetalol, based on those trends that they were seeing. On the 18th of May, so 2 days after she was admitted, Corinna's blood pressure stayed normal, but a note at 8:30 p.m. stated that the nurses had noticed pitting edema on her feet. The note also included information which was interpreted by the coroner to mean that the obstetrician saw Corinna but gave no further orders as to her care. So pitting edema happens when there is excess fluid built up in the body, And it's called pitting edema because when pressure is applied to the swollen area, it leaves an indent.
So you push a pit into their leg.
Yeah, and it stays there rather than...
Okay.
normally when you press your skin,
It
It
sprinkles
goes
back.
back. Yeah.
On the 19th of May at 12:20 a.m., Corinna's blood pressure was 150/86, and a midwife saw that she had pitting edema to her knees.
Gosh, that must not be comfortable.
At 5:45 a.m., Corinna complained of back and shoulder tip pain, and she didn't think contractions were causing the pain. Her blood pressure at this time was 163/88. The patient notes indicated that the midwife had advised the obstetrician of all of these symptoms, and he ordered Panadeine Forte for the pain. At 6:35 a.m., the obstetrician was told that Corinna was having contractions, so he told staff to take her to the delivery suite. By 10:30 a.m., her blood pressure was 150/70, and it increased throughout the day. At 2:54 p.m., a baby girl was born, followed by the second twin, another girl, at 3:07 p.m. Corinna was discharged from the birth suite at 5:30 p.m, and her BP was 138/76 at that time.
Discharged from the birth suite home?
No, I think onto the ward.
Okay.
At 6 p.m, Corinna advised staff that she had central chest pain, upper abdominal pain, and back pain between the shoulder blades. The obstetrician was there at the time, and he prescribed morphine because he thought the pain was musculoskeletal.
Get that she's just pushed a baby out of her abdomen.
Two babies.
Sure, 2 babies. Sorry. She pushed 2 babies out. So sure, there might be some
Discomfort.
Yeah, it's not
but
exactly
I
a pain-free procedure.
normally expect it to be in the chest, I would have thought.
Mm.
Again, not an obstetrician, so have no real idea. But yeah, I would have thought that the highest pain would have been in and around her vagina.
Well, yeah. That's where the baby came out.
Yeah. My very little understanding of childbirth is that the pain is in and around that area.
Which makes sense. Maybe some abdominal pain. Yes. At 6:05 p.m, her blood pressure was 189/91.
Ooh.
So midwife recorded Corinna's blood pressure as 188/100 at 6:15 p.m.
That seems...
High.
I would have thought that would have triggered some sort of immediate response when she got to the 191 before, not even this one. But anyway.
The midwife said that the obstetrician was in the room at the time and saw the result. She said that he asked her to keep him informed and left at about 6:20 p.m. Another midwife noted at 6:53 p.m. that the morphine hadn't given any relief for the pain, so she contacted the resident medical officer on duty. That resident medical officer came to examine Corinna and noticed that her blood pressure readings were very high, but didn't make any notes to that effect.
Oh, that's unhelpful.
The resident spoke with the obstetrician about his findings and his plan, which involved contacting another doctor for another opinion, ordering some tests, and treating Corinna for a possible pulmonary embolus. So that's when there's a blood clot in the lung, which blocks blood flow to a part of the lung. And they were thinking that based on her factor V Leiden mutation.
Yeah.
While the plan was being carried out, Corinna's partner came out to tell the resident that Corinna was very drowsy and couldn't move her arm. The additional doctor who had been contacted went to see Corinna and immediately saw that she was very unwell with a possible brain issue.
Oh, that escalated.
Mm.
Okay.
A CT scan was done which showed a significant hemorrhage in her brain.
Oh, is this because she's a clotter?
No, she's had a hypertensive crisis.
Oh, okay.
So her
Yeah,
blood
maybe
pressure
it
is
is,
so high that I imagine she's popped a blood vessel in her brain.
Yep. She was transferred to the Canberra Hospital for emergency neurosurgery. After surgery, Corinna's prognosis was poor and the surgeon did not recommend any further surgery. So on the 22nd of May at 5:03 p.m, 3 days after giving birth to her twins, Corinna passed away.
That's devastating.
An experienced obstetrician was invited to review Corinna's care and treatment in relation to the possible development of pre-eclampsia, which is a pregnancy complication characterized by high blood pressure. So the expert advised that it was reasonable to consider the abominable snowman.
You've got to consider him in all your medical diagnoses.
That's important for the coroner to consider.
Try that again. The expert advised that it was reasonable to consider the abdominal and chest pain as possibly related to a blood clot on the lung, and therefore start treatment of this, pending imaging of the lungs. However, he stated that her elevated blood pressure from 6 p.m. on the 19th of May onwards required treatment which she did not receive. Corinna's blood pressure at that time put her at significant risk of a brain hemorrhage. So essentially they're saying she should have been treated and she wasn't, and that's what then led to her death.
Yeah.
He said it wasn't clear, based on the medical notes that were taken, why her hypertension was not treated, and advised that there were several medications that she could have been given safely to lower her blood pressure.
I guess there was that point where you mentioned that the obstetrician said he wanted to stop the medication if the diastolic got too low.
Yep.
So maybe he was concerned about low blood pressure with the medication she was on. Right. And it's clear they were taking it very frequently. Like, they knew it was a worry.
Yeah, they were definitely monitoring it.
And like those numbers you read out, it was slowly increasing over time as well. You could definitely see that trend was going up rather than staying the same.
Yep. It was his opinion that the labetalol should not have been stopped on the 16th of May because hypertension that starts during pregnancy usually gets worse at the end of the pregnancy.
She wasn't even near the end anyway. She was only 33 weeks, right? Okay.
But he's saying, like, if you'd started it at that point, you shouldn't have stopped it. You should have just kept her on it until the end of the pregnancy. Once it wore off, her blood pressure was likely to rise again, although it may have been mitigated by the epidural, which can lower blood pressure.
And did she have an epidural during her?
I think she must have.
Okay.
Yeah. So, yeah, what he's sort of saying that, like, yes, it was stopped, but potentially the reason they didn't see an immediate spike was that she then had that epidural, which kept it low.
Yeah.
And then once the epidural wore off, it started rising.
Yeah. At some point, we will get to my epidural case, and it will be great. I think you guys have heard me talk about that one a lot.
Mm-hmm. The expert considered the blood pressure readings on the afternoon and evening of 17th of May to be at the upper limit of normal, which the obstetrician should have identified as the blood pressure starting to creep back up after the labetalol was stopped. He believed that Corinna's increasing blood pressure should have been treated when the obstetrician saw her at 6 p.m. with a blood pressure of 190/90, and that there would have been no downside to giving her the medication. So even if they didn't think it was due to pre-eclampsia, there was nothing stopping them from giving her the medication to treat it.
Yeah. It's one of those really interesting ones. Like, that seems so high that I would have thought that would have triggered an emergency call.
Yeah.
For multiple people to have come and...
Yeah, it depends on their protocols, I guess.
Yeah.
The expert advised that the most probable diagnosis for Corinna was pre-eclampsia for the following reasons. She had increasing blood pressure, as we've already talked about. There was a sharp increase in her liver enzymes, which indicated liver dysfunction, and she had decreasing platelet levels. And so to this expert, those would have all been, those three of them together, it was an indication that there was something going on. It was likely pre-eclampsia.
Yeah.
The obstetrician's legal team asked another doctor to put together a report on Corinna's medical care. This doctor stated that, in his view, Corinna was not suffering from pre-eclampsia because although she had high blood pressure, she did not have edema or protein in her urine.
But they talked about her pitting edema so many times.
Yes.
And she came in stating she had protein, right?
Yes.
Okay.
Yep.
And that was information she'd gained from her own obstetrician?
You would assume so. Where else would she have gotten that information? Like, when she went into the hospital first time.
We presume that came from her obstetrician.
Would have had to have.
Okay.
Yeah. The coroner found that this was inaccurate because Corinna had both protein in her urine and swelling at least as early as the 13th of May.
Okay, cool. Thank you, coroner.
Yep. It seems that this doctor was not provided with the material that suggested the existence of these symptoms.
Oh.
What?
Not ideal.
So it was not given the same information that the coroner ended up getting.
Right, so their expert witness on their behalf was only given half the story to therefore play into the story that they wanted.
Yes.
Entirely speculation. We don't actually know that.
Allegedly.
Allegedly.
His opinion was that even if a diagnosis of preeclampsia was made, it would have taken a considerable time to order and deliver the proper treatment. He concluded that Corinna's death was not foreseeable, and the only criticism of the obstetrician was that he wasn't fully informed.
I think that's really difficult for an outsider to come in because he's been hired by the obstetrician's legal team, but is he a colleague? Is he a junior to? Is there any implication to him by providing that evidence if it's not in line with the obstetrician that might negatively impact that person, that may have swayed them? But I disagree with it would have taken time to order and administer.
Exactly.
The answer is you do it anyway, because at least if you're doing it, sure, if the outcome is still devastating, you've taken actions towards trying to change that.
Exactly.
Versus electing to not do anything. But I guess, this expert is trying to say that the obstetrician wasn't properly informed and so therefore couldn't act because he didn't know. But I really struggle with that as well
Yeah.
because there are statements from the other staff that he was in the room at the time.
Yeah.
Yeah.
And I also think that statement about it would have taken time to order and deliver it. Pre-eclampsia is not uncommon. High blood pressure is not uncommon. You would think that there are drugs to treat that would be on hand,
Freely
especially
available
in
an
a hospital that delivers babies.
Yeah.
So during the inquest, this doctor was asked whether he agreed with the expert's most probable diagnosis of pre-eclampsia. He said, I quote, "I believe that this patient had pre-eclampsia most definitely. I've never disputed that, no."
Okay.
He advised that Corinna should have received treatment for high blood pressure when it rose to 189/91 at 6 p.m, which is
shortly before she had, like, acute catastrophic symptoms, right?
It was about 7 o'clock when they realised the morphine wasn't giving any pain relief, so it was about half an hour.
Okay.
Yeah. The obstetrician was also interviewed during the inquest, obviously. He stated that he had extensive experience with preeclampsia, and patients classically present with a headache and diminished consciousness, which he never saw with Corinna. He suggested that pulmonary embolus and amniotic fluid embolism could not be excluded. I won't go into detail about amniotic fluid embolism, but the expert stated that there were no symptoms or postmortem findings which pointed to this condition.
I think for me, anything involving the lungs, I would have expected some respiratory symptoms such as difficulty breathing or dropping over oxygen levels and that kind of thing, which you've not described.
Yeah.
But again, I agree that they're probably on that differential list.
Yeah, for sure.
And so, yes, they needed to be considered as well. But yeah.
Yeah. It was suggested that Corinna was prescribed the labetalol because of preeclampsia, which the obstetrician denied, stating that it could have been as a result of a number of things.
He prescribed it. Can't he tell them what he prescribed it for?
You would think so, yes.
Oh, but
He's just saying, no, I didn't do it because of preeclampsia. I think he was sort of saying, well, I did it because of the high blood pressure, but that high blood pressure wasn't related to preeclampsia.
Okay.
Yeah. It was then suggested that he diagnosed and treated Corinna for pregnancy-induced hypertension, which he agreed with. So he's saying he was treating her for, pregnancy-induced hypertension, not preeclampsia. The obstetrician stated that he saw Corinna at about 6 p.m. on the 19th of May and stayed with her for about 20 minutes. He said that he took a blood pressure reading of 189/89 and wasn't aware of the other readings of 189/91, 177/93, and 190/90. When it was suggested that he would have access to the general observation charts, which had recorded those readings, he said that wasn't true, even though that directly contradicted something he had said earlier in questioning.
But also, he's saying that he wouldn't have access to general observations of his own patient?
Apparently, yes.
Okay.
Yeah. And even he said he took the blood pressure reading of 189/89. That wasn't drastically different to the other readings either.
Anyway.
It's not like that was already high. Yeah, and I'm not sure whether I go into it later, but essentially he says the midwife never told him. But those things were recorded on the charts. That's how they had records of them.
Look, so many questions. It's not really painting him in a great light, is it?
No,
and I get he
not.
could have been stressed, so him contradicting himself might be permissible there.
And obviously
little,
the inquest
but
isn't done immediately afterwards. There is a time delay.
There's always a time delay, and that retrospective thought processing can have some biases to it.
Yeah. He stated that Corinna had a concerningly high systolic blood pressure and the diastolic was at the upper normal limit, but that he thought it would be dangerous to treat the high blood pressure at that time because they didn't have a diagnosis.
Okay.
He stated that the most common cause of high systolic blood pressure is untreated pain. I don't know, that's not incorrect.
It's not incorrect, I don't think.
But in the context of everything else that's going on with her.
And I don't think, again, that it would have necessarily been of harm to try both either way. Like a bit of pain relief and a bit of blood pressure medication.
Yeah. But he was questioned whether any hypotensive medication was given, and he said that's right. But when questioned further, he stated that none were given. So again, he's contradicting himself as to whether blood pressure medication was given.
Yeah.
He stated that the only blood pressure he was aware of was the one at 190/90. He agreed that a blood pressure of greater than 170/110 should be treated, but disagreed that a blood pressure of 190/90 would have represented severe hypertension.
I assume that experts disagreed with him there.
Correct. And the general, all of the guidelines that are out there disagree with him as well.
Yeah.
He rejected the idea that the time frame from 6 p.m. to 8 p.m. on the 19th of May allowed sufficient time for the administration of an effective antihypertensive treatment. He stated that the game changer was when the blood pressure was 197/112 at 7 p.m., but that he was never told about that blood pressure reading at the time and only found out afterwards when the resident told him. He stated that Corinna's condition was confusing and everyone was concerned about giving blood pressure medication if the diagnosis was incorrect. When he was questioned about the expert's opinion that there would be no downside to starting this treatment, he did not answer the question but explained his concerns.
And look, that's fair. He can explain why he had concerns, and there are valid concerns there, but I think still the benefits of giving the blood pressure appear by the experts to still be outweighing
Correct.
the negatives, negative possible consequences.
Yeah. The obstetrician denied knowledge of the blood pressure readings done by the midwife at 6 p.m. on the 19th of May, and also of the resident reporting the high diastolic pressure over the phone.
He's really fixated on this diastolic pressure.
Yeah, very much so.
Okay.
Ultimately, the coroner found that the obstetrician was advised on multiple occasions about Corinna's high blood pressure. So essentially, the coroner didn't buy him saying that, no, I didn't know about it. Yeah. Because there were records to indicate otherwise. Yep. The obstetrician read paragraphs from the Medical Board of Australia's Professional Standards Hearings Investigation, which happened after the death but before the inquest, which stated that the allegation that he failed to correctly diagnose the hypertensive disorder was not proven. It accepted that there was conflicting evidence, and it had accepted that the postnatal hypertension did not warrant immediate intervention. So essentially, the review that was done by the medical board said he's not
incompetent.
Yes.
But we kind of touched on this, even just the last case, like the Air Max one, that the coroner's not there to discipline or have other actions. I guess he could refer to the medical board, but they're not there to lay blame. They're there to identify public risk. So it doesn't really matter what happened in that. The coroner is still expected to do their own inquest and their own understanding of the event. And we even saw the contradictory information in Air Max where the investigation had stated that Mr. B had provided the owners with the DRN, which the coroner found was unable to be determined. Yep. So I just don't think that that information is relevant. Yeah, it's just interesting that he brought up the medical board. So despite him bringing up these items from the medical board's review, the coroner found that the board engaged the services of an expert witness who criticised the obstetrician because he failed to respond appropriately to the blood pressure reading at 6 p.m, but then rejected his report in favour of a panel member's view of whether the treatment was appropriate. Right. Interesting.
Ultimately, the coroner found that the obstetrician failed to give appropriate treatment to Corinna between 6 and 6:30 p.m. This failure led to her blood pressure continuing to escalate, which caused her cerebral hemorrhage and death. The coroner found that the treatment was available in a time frame to have reduced Corinna's significantly high blood pressure. Therefore, her death was likely preventable. So, going into the coroner's recommendations, they had 4 recommendations. The first was all nurses, midwives, GPs, and obstetricians involved in the care of pregnant women undertake specific training with respect to pre-eclampsia and the risks it poses both ante and postnatally.
Was there much opinion from the nursing staff that was involved in this? Because they haven't really mentioned how much they had worries for the patient or anything like that.
They didn't go into it too much, but they would have, like the fact that after they told the obstetrician he did nothing, they went to someone else and said,
nothing's been done.
This is still not working. Like the pain relief he gave is not working. Can we get something? So I think that the nursing staff were very aware that this was not right. Yeah. And they were keeping a very close eye on her. But I guess in the end, it comes down to the doctor prescribing the medication. They can't. They can't prescribe it themselves.
Yeah.
Number 2 was literature such as the Pre-eclampsia Foundation brochure be provided to pregnant women by their practitioners.
Nice.
So giving some information to pregnant women so that they're aware of the
risk
signs
factors.
and
just empower them with that information of things that they may need to know. That's really good.
Number 3, a patient's complete notes be sent with the patient when they're discharged from birth suite to the ward. I would have assumed that already was in play.
Happened. Yeah, where did they go?
Yeah.
Okay.
Who knows?
Oh, that's less than ideal.
Yes.
Are they just implying that the notes weren't complete? Like people were still writing them at the time that they
potentially, or like maybe they weren't maybe they came a little bit later after the patients get moved to the ward. Also, number 4, this comes back to that, all staff treating a patient should be encouraged to take notes at the time events occur.
Right, so they're subtly suggesting that those notes did not get written in a timely manner.
Yes.
Okay.
Correct. After the inquest, the ACT government agreed with the coroner's recommendations. They advised that medical staff will be given compulsory training on hypertension, and both the private and public hospitals will hand out fact sheets and brochures on preeclampsia.
Mm-hmm.
The private hospital staff will receive education on note-taking, and the public hospital will have an external consultant to train staff on maintaining notes. So the obstetrician's clinic issued a statement after the inquest was released, saying that the inquest had 2 fundamental errors. He disagreed with the finding that he saw 2 key blood pressure readings, saying that there was no evidence to substantiate it. He also said that the 2 other doctors who saw Corinna agreed with his likely diagnosis of a pulmonary embolism, and that another doctor agreed with him that giving antihypertensive medication was not recommended in the case of a pulmonary embolism. So essentially he's just trying to defend against
He's defending
the coroner's inquest.
Okay, we'll accept he didn't know about the 2 blood pressures, and I'll just say that's fine. Why that was relevant for them to put out, I don't really know. But
yeah, I think that was a real sore point because the coroner said, you knew about them, and he was like, no, I absolutely did not, and really stuck to that.
But he's saying that 2 people agreed with him or his diagnosis. One of them was the junior doctor that was asked to review the patient. That junior doctor is in a place of subordination, is the right word? Like, to that senior obstetrician. If that junior doctor wants to be an obstetrician, if that junior doctor, is scared for their employment or has any concerns about their welfare, they're not going to disagree with you. But also they may not have the knowledge base, the experience to be able to make those higher level decisions. Yeah. That's why you are the obstetrician taking care of this patient. So you can't say that they agreed with you. There would be so many times where they would be looking for your instruction.
Yes.
That's not agreement. That's providing advice.
Yeah.
And who knows? They may not have, or they may thought of other things, but they're also not going to have, or not always going to be empowered enough to overstep the decisions you're making. So even if they disagreed with you, it doesn't mean that they had the ability to actually change or do anything differently anyway.
Yep.
And yeah, I find that a fundamental incorrect assumption that they agreed with you.
Yeah. They didn't disagree with you, but that doesn't mean they necessarily. And also, like, they're being called into what's now an emergency situation. Yeah. They don't know this patient as well as you do because they haven't been with her for her whole pregnancy.
Yeah.
They're coming into it in an already high-stress environment with not as much information.
Yeah.
You trust those senior doctors.
Yeah. So
the obstetrician actually went to court to try and nullify the coroner's report.
I didn't know you could do that.
Yeah.
Okay.
I didn't know you could do that either.
Yeah.
There you go.
Yeah, I didn't know you could argue what the coroner said.
Yep.
And he wanted to nullify the whole report?
The whole report.
Okay, so not even just the information about him.
The whole thing.
But I guess it's mostly about him.
Yeah.
But it's not all about him, but it is
but it
kind
is
of
really
all about him. Okay.
Yeah. So the judge did actually find that the findings in the coroner's report about his diagnosis and treatment were unfair because a number of the final adverse comments weren't part of the counsel assisting submissions, and these should have been provided to the obstetrician for comment.
Okay.
So a bit of a technicality there in that he wasn't provided with that information to be able to comment on them.
That is a really fair point of it coming back to those coroners and saying you do need to be fair and impartial about the things that you're saying and making sure that they are appropriately managed, such as giving people opportunities to have their input in terms of things that are negatively impacting them, because this is obviously going to negatively impact this obstetrician, absolutely. And so whilst it's not ideal that he had to go to court for that, but I do see what the judge is saying there in terms of that probably is important for them to make sure that they are
following that correct.
It's just following due process, really.
Yeah, exactly.
Make sure the process is followed correctly.
However, the judge did not find that the entire inquest was miscarried and rejected the obstetrician's request to quash the entire inquest.
And I imagine, actually, now that I think about it, some of that potentially would be with regards to civil suits as well, because if it got quashed, there would be less evidence for a civil suit for that family in terms of wrongful death.
Yeah, that's exactly right.
Yeah. So in 2017, Corinna's partner and children were awarded $1.2 million in compensation.
Doesn't
Yeah,
seem
okay.
like very much.
Yeah,
No,
1.2
it
for a
doesn't.
person is not enough, especially now that the father is raising
A
twins.
single father
Well,
of three
three,
kids.
yeah, he's got-
Oh, yeah, it was their second
Already got
pregnancy,
one
wasn't it? Yeah.
child, and now they've got newborn twins to look after.
That's
Mhm.
Not
devastating.
newborns by that point, but yeah, just...
Gosh.
So yes, that's Corinna's case, something that's just super sad that should
Yeah.
not have happened.
Absolutely.
But hopefully with the recommendations the coroner made and the things that the public and private hospitals put in place means that won't happen
Yeah, I
again.
like that they extended to public hospitals.
Yeah,
Because I guess technically they didn't have to.
but I think there's only potentially one public and one... Like, there'd be only
Right,
one
it's
public
Canberra,
hospital.
that
and-
would be why.
Yeah.
Okay, yeah, right.
It's such a small state that,
Yeah.
yeah, it's a bit easier to do it for both because there's only, I'm guessing, a
So there are
handful
five
of hospitals. Yeah.
Yeah. What do we learn from this?
In this case, I think that the fact that she had these other medical conditions was a bit of a
Clouded.
red herring in terms of her care, because they were going, she has this mutation, she has this issue, that's going to be the cause of her problem, rather than looking at taking a step back and just looking generally at her case and what would we expect for these
Yeah.
symptoms.
Yeah,
Mm-hmm.
yeah.
So I think that was a complicating factor for her medical care. Whether the outcome would have been different had she have not had those
yeah.
other medical conditions, I'm not sure. But
Yeah, it's a
even if
tough
she
one.
did, my mind still goes back to the fact that they should have been treating her based on the symptoms she had.
Yeah.
Exactly.
And that doctor probably should have been a bit more knowledgeable about the symptoms of preeclampsia, because he was saying she didn't have a headache and she wasn't losing consciousness, she didn't have preeclampsia.
Yeah.
Well, that's not all patients are going to present the same way.
With the exact defined spectrum of, or there is a spectrum of symptoms, not
Yes.
just those two that he's defined.
Yeah, and he also wasn't following the medical guidelines. So he should have been a bit more knowledgeable about those as well.
Guidelines, not absolute. And so he
yes.
was making some statements around he had thought about it and elected not. But in this case, it seems like it was misguided.
Mm,
It's disappointing.
it is. And disappointing for her family as well, obviously.
Yeah. Yeah. And very rare, though. Like, I guess, women losing their life after childbirth is pretty rare in Australia now.
Mm.
So extra devastating when you go in thinking that it's probably going to be a safe.
Yeah, I guess you
Practice.
make that assumption.
Especially for someone who'd already had a pregnancy that, yes, was an early delivery, but I'm assuming that all went fine for
Yeah,
her.
I don't think
she
there
was
were any other
probably under,
complications.
the impression that 33 weeks, so I had my last
Baby
child
at
at
32.
32 weeks, so
Yeah.
everything will be okay.
Yeah, and even if she was, she obviously had the pitting edema, there were some signs that everything wasn't amazing, but you then remember to be an advocate for yourself.
I think
Yeah.
so.
And the
Yeah.
more that knowledge is power, like the more you know about all of the possible complications without.
Like, having a preeclampsia brochure given
Yeah,
to you.
which is, I think, is a really good idea. And I think like this links a little bit back to Ryan's rule in terms of being able to get a second opinion if you're not happy with your medical care.
Yeah, true. It would have been interesting to know how easy it would have been for them to escalate their concerns as well, and what kinds of concerns they had at the time, because that would have made that whole situation much, much more challenging if they were trying to escalate and were unable to. And so hopefully Canberra has some similar sorts of things in place like Ryan's rule as well that would allow families to do this as well,
Mm.
to escalate as well.
Just looked it up. Canberra Hospital, I think that's the public hospital,
Yeah.
has a program called CARE, which is Call and Respond Early. Similar program to Ryan's rule, where a family member is asked to raise their concerns with nursing staff and then they can call a number to request a review of the patient. So
Yep.
similar things in place. I don't know how long that's been in place though.
Well, thank you very much. That was an insight into how you can actually request a review of a coronial inquest.
Yeah.
Actually, I think is probably what I learned from this one.
Yeah, interesting from a medical point of view, but yeah, also interesting from that legal point of view of you
Yeah.
can essentially disagree with the coroner and...
I mean, you can always disagree with the coroner.
Well, yeah, but you can...
That's fine. It's fine to have your own opinion.
You can try to legally disagree with the coroner.
Yeah, there is a legal escalation process.
Yeah. Which makes
Good to
sense that
It does.
I mean, you
There
can
would
appeal.
be,
You
but-
can appeal court cases, so
Yeah.
I wouldn't see why you wouldn't.
But I've
be
just
able
never thought it.
Yeah, I've never thought it's something that people do. But
Yeah.
of course, it would be if you don't agree with what the coroner recommends.
But I mean, this did result in them saying, "Yeah, you've probably been a little harshly unfair on this individual." So
Yeah.
It
was
could
worth
affect
it.
his career going forward for sure.
Yeah,
So.
yeah. So,
Thank you, everyone, for listening.
and we will catch you again next time.
See ya.
Bye.
Bye.